Dr. Dara here, and I'm here in my office with Mr. Najee-ullah, part of a family as far as how we've been taking care of him.
Exactly.
You would be a perfect example of someone who is very sensitive to blood pressure medications and diet when it is related to salt. For the record, that all privacy issues is okay as far as filming and for it to be shared with people who have issues with high blood pressure, and we'll talk about salt. Alright, so this is salt that you take. This is how much salt that we have in our diet. I don't know if you've seen this before. So this is 1 teaspoon of salt. And it's recommended that you don't eat more than 1 teaspoon.
I don't eat anywhere near it, I think.
So you eat meat or you don't?
No.
You don't eat meat?
No.
Because, obviously those who have meat, the flesh itself has more salt.
Right, I don't eat any meat. Only fish and chicken sometimes.
So, meaning that you don't eat...
I don't eat lamb, I don't eat beef, I don't eat pork.
But you do eat chicken and fish?
Yes.
Okay. So chicken and fish will also have salt. We're salty. All animals are salty.
Right.
It's not only what we're sprinkling on, but it's also inherent to the food itself. Chicken, fish, any animal, honestly, is going to be salty. It's
right.
Animal flesh.
Right.
But we also add a lot of times sauces, so it's not only stock, but seasonings that already contain salt in it. Even bread, they add salt to it. So bread actually has more salt than, say, a pretzel. But a pretzel tastes like it's salty because the salt crystals are on the outside.
Right.
So just to show an example, this is how much the average intake, teaspoons of salt, average American intake is this much per day.
Wow.
Right? This is how much 1 teaspoon that we don't eat more than this much. Okay? What we need for our bodies is really not that much at all. Just to stay alive, we do need some salt to stay alive, but this is a 1/4 teaspoon. This is the maximum amount of salt that we need per day.
Wow.
So people who have high blood pressure, it's recommended that they eat less than 2 grams per day. And then if you look at what we have in normal food, this is a medium, very, very little.
Yes.
Like this is so little of how much, it's like a couple crystals there. This is 1 medium potato, 3 ounces of pork chop, a little bit more, homemade soup without added salt. So if you make your soup by yourself, soup stock, without things like adobo, bouillon, if you make it yourself, it's far less. This is 8 ounces of chicken noodle soup. This is what they have. That's already processed.
Okay.
So when you don't know what you're eating, then you rely on the manufacturers and whoever makes the food to determine the salt content.
Right. And normally I don't eat canned soup. Usually I make it myself.
Yeah, but like those who know what is in their food knows what they're putting into their body.
Right.
But this is really a prescription itself. So when I say take a salt tablet, or when I say have a packet of salt in your pocket, that's a prescription. Right?
Okay.
Without it being prescription. Or when I say, cut that out, I mean, we're just continuing things that you're putting in your body. So I think of the refrigerator as, in some ways, your medicine cabinet. Right?
Exactly.
So this is potato or tortilla chips. So, I mean, it's not a whole lot, but they add salt to it.
Right.
This is a cup of canned chow mein.
Wow.
3 ounces of ham.
Wow.
So 3 ounces is not a lot. Ham, it's a processed food, right?
Right.
You can taste it. I mean, the way that you
You can taste it, right?
You can taste the salt, but we don't necessarily pay attention to it. But if you put it in just regular water, by osmosis, the salt will come out into the regular water, and you taste that water, it's salty.
Right.
So rather than taking the whole ham, if you need that meat and you need that flavor, and you'll miss if you don't have it, then just a small amount actually goes a fairly long way. 1/4 pound cheeseburger, right? 1 hot dog, 1 tablespoon of ketchup, 13 chips, a teaspoon of mustard, and 1/2 cup of baked beans. So way more than we need.
What is the difference between sea salt and like they have regular iodized salt? Does it make any difference?
On a cooking side, there is.
Right.
If you were to compare regular iodized salt and regular sea salt, of that to make it as salty as the regular salt.
Okay.
And the iodized side, they add the iodized because it's a mineral that we need in our diets. So that's just an additive.
Oh, okay.
So if you had a choice between the two, the sea salt is the better option.
Got a better option.
Is a better option.
Oh, okay.
The better option, even beyond that,
None.
is none. And I can show how to read the nutritional labels because we don't even realize that on the nutritional labels, there's a difference between what low salt is, what lower salt is, what no sodium means. So they have that recommendation and also percentages. Okay, hi. So I'm going to move into put on my doctor hat. As a nephrologist, we're talking about salt and high blood pressure all the time. I want to explain something about salt and what it means to have less salt or less sodium. Just because it has the green top doesn't mean that it's healthier for you. Less salt means is that it is less than the original. If I take a look at this and we see how much salt it has, 920 milligrams per tablespoon, which is 40% of your total daily value. 2 tablespoons is already your limit. Now if I look at the less salt, which is the green top, the sodium of 520 milligrams, which is 23%. It's not 0% or very little salt. It's just less salt than the original, and it really depends on how much the original of regular salt there is. As a comparison, let's look at another brand and see if that still holds true. So here's Pico Man, and let's test this out. 960 milligrams, which is 42% of your daily value. 1 tablespoon already contains 42% of your daily needs. And then I'll compare that with the label, see red top, green top, less sodium, 590 milligrams, 26%. So again, it doesn't mean 0, it just means less sodium than the regular. And here it even says 38% less sodium, but that does not mean 0. So what you're looking for if you have high blood pressure or you're watching your salt content is not necessarily to look for the less sodium. Really, it's to look for the products that says 0 sodium or no sodium. And if you really want to make a replacement, honestly what you would do is replace soy sauce in this example altogether. And a really good option is black vinegar. So use black vinegar. That's an Asian product. It still gives you that bite. It gives you that taste and flavor without adding the extra salt. So there's your nephrology tip of the day.
Yeah, and I've learned that from you, because one time we had a conversation about low
salt.
Soy sauce.
Soy sauce, yeah.
So, and you said to me, but what is low dose? Low compared to what? So from that point, I don't use any soy sauce at all.
Really, none?
None.
Oh,
I threw it out.
I threw you off of all
No,
the
it's okay.
forever.
It's okay. My health is more important than the sodium taste.
Yeah. But it's not only soy sauce. It's also ketchup. It's also mustard. It's also all these seasonings that they add. So it's not so much the food itself, but it's all those flavorings.
Right.
And you can find something to be tasty by adding other spices other than salt. And I think you've done that well, using a lot of Caribbean spices without added salt.
Right.
Yeah. So parsley, garlic,
Right.
ginger, all those aromatics.
Right.
I mean, you can also add that through natural foods,
That's
like
what
mushrooms
I do. Right.
and kelp. You know, I mean, the things that come from the sea though is going to have salt in it.
Right.
But the way to counterbalance that is you can dilute it. So if you have something that has salt in it, you know, who's to say that you have to use the entire piece? You can cut that in half and then add things that have much less salt.
Right.
And your tongue will get used to it. But at this point, I think a lot of things are over-salted and overly sweet.
Right.
So and we just get used to that higher level of salt. And that's why when things are too salty, we need water. Because that's your body's natural reaction of this is too salty, we need water. But that's what your kidneys do too. Have you ever noticed in a bar, I don't know if you go to the bar anymore these days, but in a bar they put snacks. They put snacks out.
Right.
They used to put salted peanuts and things like that.
Right.
Why? It makes you thirsty.
Right. Okay.
So if you eat salty snacks, then you're going to order more because the salt. So what the salt does, it wherever the salt goes, the water follows.
Oh, that's what the trick is.
Yeah. Learn more about hidden sources of salt and sodium in foods in the video description, and next time we'll talk about high blood pressure and how to lower your pressure by eating right. See you next time.